Okay, let's get started, y'all. Thank you so much for being on time. Thank you so much for being patient with us. My name is Jeanette Ruiz. I am the Executive Director of the Miami Climate Alliance, and we are a network of individuals and organizations working on people-centered solutions to our climate crisis. And today, we have one of those solutions offered with this educational and informative heat and health training. We've teamed up with Florida Clinicians for Climate Action, and you will hear from its founder, Dr. Cheryl Holder, as well as nurse practitioner Carol Lindsay. So I'm going to give you a breakdown of what you have for this hour. First, we will hear from Dr. Holder and then offer a short break for questions. And then we'll hear from nurse practitioner Carol Lindsay and offer another break for questions and answers. And then we'll close out by 7 p.m. So I have my lovely team with me today. So we have Princess Harper, our outreach and membership coordinator. She's waving there, as well as Jose Santiago Castro, who's our communication strategist. They're going to be monitoring the chat box. So Princess is in charge of the Zoom chat box. Jose is holding it down on Facebook. So please, as you have your questions, enter them in the chat box. We're going to keep track of them. And when the time is appropriate, we will answer as many questions as possible. Okay, and then just the last note is that this call is being recorded. So we're sharing it out so that we can share it out later, just so you guys know that it's being recorded. With that, let's get it started. I will kick it away to Dr. Holder.
Hi, good evening, everyone. This is great. Thank you for bringing this collaboration together. We've been part of Miami Climate Alliance for a bit, and this is what we want to do. Like you said, people solution, and we want to get the information out to folks. Could I get the share turned on, please?
Absolutely.
Still not on.
Now?
Okay, let's try. Okay. Should I just allow multiple sharing? I guess. Okay, so let me get my presentation up. And let me just put it in the slideshow. Okay. I always start off with this patient because we're patient-centered. This is what we do as clinicians. And she embodies everything that I do when I work every day in the communities. I've been in Opelika, Miami Gardens, Homestead, everywhere in this county. And she was a Black woman who came in from Opelika. She had lots of chronic diseases, on lots of meds. But when she came to me with the climate problem in 2016, I didn't even quite realize what it was until I started trying to put some pieces together because she could not pay her bill, her light bill. The energy burden from trying to keep her house cool at night, because that's when she got triggered, was way too much for her. So she ended up needing some assistance. So what I started learning, and I'll just quickly summarize here about climate change and why it's so important that we as a community understand what's happening, is that the days and nights are just increasing, the hot days, hot nights, especially the nighttime. So if you're noticing your bills are higher, your AC is running even more, those increased nights is what's really driving so much of our discomfort and some of the health impacts that we're seeing. And when we look to see what is going on, when did this all start? Why did it happen? We know it's been hot, but we've monitored the planet's temperature. And this is a NOAA slide, the National Oceanic Atmospheric slide. And they showed that the temperature fluctuated regularly pretty reasonable in our planet for hundreds of years. And then around 1815 or so, when we started becoming industrialized, when we started getting all this modern ability to have cars and planes and trains and everything that we do, and our buildings and our concrete and the quality of life that some parts of the world are experiencing and enjoying, we had a price of sending up pollution into the atmosphere. And when you look at what happens to our planet, there's the atmosphere that houses the right amount of particles and gases that keeps our planet not too hot, not too cold, and that's why life came on planet Earth. With this pollution, we're seeing more particles in the sky and also gases. And that gases, think of yourself of wearing like a fleece blanket around your whole body. And that whole body gets a little bit warmer and a little bit warmer the more you put in that filling. Actually, it's not even like a fleece. It's more like a down that started off thin, then the down just got bigger and bigger, and you kind of get enveloped and it's warm. And as the planet gets warm, the oceans absorb so much of the heat, and it absorbs and absorbs, but as it gets warmer, it also evaporates. And so the evaporation then sends more moisture in the sky. And we have this cycle that we're experiencing that when it rains, it's intense, there's so much rain because the Arctic, the ice is melting, and the ice used to block the sun from staying on the planet. Now the rays are just being concentrated, the pollution, the heat, and it's really impacting us tremendously. So basically, too much CO2. We put a lot of it there in the last 200 years, but that's the good thing. We have a chance to bring it back down. So that's the one advantage that we know it's not natural. It's not that the planet's doing this. It's that we've been doing something, because if this were happening because of the planet, we wouldn't have a chance. But because we know we have done it as humans, we have a chance to make those changes. And I just go through again, so you won't have any misunderstanding. They go back hundreds of years, and there's our planet pipping along with how much junk is in the atmosphere, keeping us nice and just right. And then we started putting stuff in with our Industrial Revolution, and we got to this, where the days are hot and the nights are hot. But that little shift doesn't seem like a lot on a graph. But when you talk about your body, think about it when a baby gets a temperature and a newborn, and that baby newborn is usually 98, then you start seeing 99 and 100. The whole family is in panic for that newborn. What's happening to the newborn? Our planet is like a newborn. So that little extra 1-2 degrees that you say, oh, it's always hot. No, it's really almost, it's an emergency, just like that baby. And we know where it's coming from. In South Florida, it is coming from our transportation because we have so many roads and highways. Other parts of the world, it comes from burning the fossil fuel, from all the oil and gas. Some other parts is from agriculture and buildings. But when you put it all together, you see it comes back down to how we're using our planet and what we're putting out to have the life that we have. This showed up Sunday, the hottest day on record. Between the time I made this slide and today, this record was beaten. It was beaten on Monday. So Monday is now the hottest day on record in our entire planet. And we know last year we hit all the records and we had excess deaths and we suffered a lot. And we know this summer is even worse. Heat is the #1 weather-related killer. It kills, it kills, it kills. It's so unfortunate because we can prevent this. And that's why we're on here today, to show you how to prevent this. And that's where Carol will come in soon to talk about preventing it. Because we are going to have more and more hot days because the planet is overheated. And until we get it under control, which we know will happen in the next 10 to 20 years, we got to figure out how we're going to cope with this. And that's why we do this. Some communities more than others, if you're rich enough, and you can see where the blues are and the greens are, the blue zones are the more rich communities. They have more trees. The rest of Dade County doesn't have a lot of trees. So we know the rest of the county is suffering in heat, especially at night. These are the high-risk communities: Homestead, Florida City, Hialeah, Miami, Opelika, Miami Gardens. Hot, 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 5 to 10 degrees hotter. So when you hear those heat index days where it feels like temperature because of humidity, and you'll get some more understanding of that as we go along, these communities are like 5 to 10 degrees more. And we know because of all the planet, you get a lot of other problems than heat. And we'll have more presentations about all these problems, these health issues. But today it's all about heat. So heat is a leading killer. High heat, humidity. And I didn't explain it, but I'll do it real quick because I think Carol's going to do it also. Humidity, think about if you need the breeze to come across your sweat to cool you down. It's that evaporation that cools you down. It's not just sweating, because you're not sweating out ice cold water. So you need cold air. You need a difference in the what the air is outside. So if the air is all wet, it's a problem. And that's what worsens everything. But we can do things. I leave with Jorge. That's where he lived. That was a very hot place. His kidneys, but he always reminds you, as everybody got to work, rain or shine, cold or heat. So then how are we going to make this happen? So again, you'll learn some more about what we do. So thank you. I'll be on later. Oh, we can have questions now, a few minutes. I hope I didn't use too much time because I know we got to catch up. So any questions at all?
You did great, Dr. Holder. If you have any questions on this section, please add them in the chat and we will definitely present them to Dr. Holder. I have a question for you really quick while we're waiting on folks. Why is it's always been hot. Like, why is it any different now?
Yeah, again, I was hoping, I love this question because I talk about it, but I hear it every day when I talk about it with my patients, especially my older patients. Oh, I've lived in Florida a long time. I remember when. And there always been records of hot days. So if you go back in the record books, you will see days that are hot, that is probably 110, 120. They've had those days on record, not as high as it is now, but they've had days that were hot. It is the gradual increase in how many in a row and the total number over time. So that's what's causing what we say it's climate rather than just the weather. So yes, you can have initial hot days, but the nights have also not been consistently elevated. So now we don't have time to cool. So it's the subtle difference in the number of days over time and the subtle difference in the nighttime. And then you see what picks it up even more are plants and insects. And that's when we see where the plants are moving to live and where the insects are moving to live, because they're moving, even fish and different, so they're much more aware than the humans are. And that's where we're seeing the biggest change, that we know it's hot, but that extra 1 or 2 degrees is traumatic for the planet.
Thank you, Doctor.
Excellent.
Thank you.
We have another question from Scott Lewis. He said, how do we recognize if someone is suffering from heat-related emergencies?
Hold that question. Carol's coming.
Yeah.
Thank you.
It's a perfect segue. I'm going to
It
share my
is.
screen now so that we could have Carol's slides up and we will get started. Go ahead, Carol.
Hey, good afternoon. I echo what Dr. Holder said. We're very excited to be here. It's great to collaborate with Miami Climate Alliance, and it takes a team to get things done. So we're the medical portion. Next slide. So we're going to talk about heat and heat illness and a little anatomy and physiology, very basic. But how do our bodies cope with heat? Well, we have something called thermal regulation, and that maintains our core temperature at 98.6. When you take your temperature, a lot of times, if you're sick or you're checking it, you see it's more or less about 98.6, which is normal. And then inside of our brain, we have something called the hypothalamus. It's an organ, and it's below the pituitary gland in our brain. And the hypothalamus is responsible for controlling thermal regulation, or you can think of it as the thermostat for our body. So it responds also if we get hot or we're cold. But what happens when we get really hot, our body goes, whoa, and the hypothalamus is alerted. And so the hypothalamus releases a lot of multi-system hormones into our body. And what happens is our heart starts beating faster because it's trying to get to our periphery to cool us off. So our blood vessels dilate. And then through our blood vessels, we have water and salt that's released. And this helps, this is sent to our sweat glands, and then our sweat glands release sweat, or we get very moist on our skin. And this is the way that we dissipate heat as humans. Water in our sweat glands evaporates, and this causes cooling for us. If you have an animal or if you've seen like a dog or a cat, they pant with their tongue out, but humans sweat in order to cool off. Next slide. But what happens when we get so hot, our body, we decompensate. Our heart at first is beating really quick. It's trying to get us cooler, like I said about the blood vessels dilating to release the sweat, but eventually it slows down and our blood vessels do not dilate. We do not produce sweat. So since we're not producing sweat, water isn't evaporating from our skin, so we don't have any surface cooling anymore. And the human thermal maximum that our body can take is 107.6 degrees Fahrenheit. However, we can decompensate our organs, our brain, all of these things can stop working even at a lower temperature when we get hot. And when this happens, this can lead to the most serious heat-related illness, which is heat stroke. We can go to the next slide. So there are 4 heat-related illnesses, but I just wanted to mention a couple more things. When it gets hot, we're not only affected by the actual temperature in the air or the humidity in the air, but like Dr. Holder alluded to, we're also affected by if there's any type of air movement, if there's a breeze or not. We're affected by radiant heat if the sun's out, if we're out in the direct sun. Also, if we're working outside, our workload, if we're working really hard, like maybe we're an agricultural worker in the fields or a roofer, and also how long we're outside, and if we're wearing protective clothing and personal protective equipment also, all of those kinds of things can affect if we're going to be more susceptible to heat-related illnesses. And these 4 heat-related illnesses, there's more, are heat stroke, which is the absolutely most serious, which can lead to death, heat exhaustion, dehydration, and heat cramps. Next slide. So somebody was asking, thank you, I think it was Scott, about some signs and symptoms of heat illness, especially in emergency. Well, this is the biggest emergency for heat illness. This is called heat stroke. And what happens is our body temperature goes too high, like I spoke about before, and our body can't handle it. So this can lead our body to where we can go unconscious. We can start being very confused. Our skin may be red, hot, or dry, or if you're dealing with a friend or somebody else that may be having these symptoms, because again, we're not sweating, that our system is not reacting correctly by sweating to cool us down. So we're going to have red, hot skin. We may have rapid, shallow breathing, possibly nausea or vomiting, dizziness, lightheadedness, or seizures. Again, this is a medical emergency. A lot of times people will go unconscious. A person can die within seconds. So this is why it's so important to react immediately to this. If you see somebody with these symptoms, especially red, hot, dry skin, you want to call 911 right away and get some help. Next slide. And then we have something called heat exhaustion. And some of the symptoms are similar, like nausea or vomiting, dizziness. Usually the person is still alert. They're still conscious. They may have a really bad headache because their blood is pumping so hard to try to cool them down. You know, they're getting a headache. They may be tired or weak. They may still faint, just like with heat stroke. And they'll usually be sweating still, heavy sweating, and cold, pale, clammy skin because their body is still able to sweat, which is going to cool them off. But heat exhaustion can quickly go to heat stroke. So you want to monitor this kind of patient. Next slide. And this is a slide from CDC, and some of the people from Miami Climate Alliance have already seen this slide, but this is just comparing heat exhaustion with heat stroke. And as you see in what I just mentioned, some of the symptoms are similar, dizziness, and also nausea and vomiting. It's not on this slide, but these are the big ones. But usually the big difference between a heat exhaustion and heat stroke is where the skin is a little bit drier, and the pulse is quicker, and the person may be unconscious with heat stroke. So again, if you don't leave this presentation with anybody else, with anything else today, this is a medical emergency. You want to call 911. And some of the actions that you're going to do until the paramedics or EMT come, or if you're dealing with a patient with heat exhaustion, you're going to move them to a cooler area. You're going to stop anything they're doing. Like, for example, if they're running or working, have them stop. You're going to loosen their clothing, remove any extra layers. You can give them sips of cool water if they're conscious still with heat exhaustion, but obviously, you don't want to try to give it to anybody unconscious because they can aspirate, it can go into their lungs, they can choke, and you can cool them down with water or ice. And with heat exhaustion, you want to seek medical help if the symptoms aren't improving. If you're not really sure if it's heat exhaustion or heat stroke, just go ahead and call 911. Better to be safe rather than sorry. Next slide. And this, again, this is something from CDC, and you can download this. It comes in English and Spanish, unfortunately not in Haitian Creole right now, but if you go to the CDC site or to this website, you can download it, and it's going to be in a longer form, which you'll see later. But these are more details to look for on the left side of the screen when you're dealing with heat stroke or heat exhaustion, and on the right side, what to do if this happens. And some of the things that are just additional, for example, with heat exhaustion, is they're talking about a fast or weak pulse, but you may not know how to take a pulse, or they may also be experiencing muscle cramps. Next slide. And the dehydration is also one of the heat illnesses that can be prevented. But what you're going to see with dehydration and what happens is that you have the person is losing more fluid than they're taking in. So their ability to conserve water is compromised. So this person may have extreme thirst. Maybe some of you have experienced this yourself. They may be urinating less frequently if you're able to observe this. They're probably exhausted. They may have dizziness or confusion. And dehydration, again, can lead to heat exhaustion or to heat stroke. And dehydration can also lead to your heart. Your heart's, you have less fluid in your body because you're dehydrated. So your heart may be beating quicker, and also to an electrolyte imbalance because you have less fluid in your body. And this can be a problem for people that may have a cardiovascular problem, a heart problem, or they may have a pulmonary problem. They may have diabetes. They may be more susceptible to dehydration or to worse health effects from dehydration because their body is already compromised with these other medical issues they have. Next slide. And then this is heat cramps. I've had these myself. If you're a runner or you're a bike rider or even a big walker, you may have experienced these yourself. And this can happen in your abdomen or in your extremities. And what happens is you have heavy sweating during intense exercise, and this causes muscle pain or spasms. And they think it's due to an imbalance of body fluids or electrolytes. But again, heat cramps is like, whoa, something's going on in my body. It's trying to tell me, calm down, cool down, stop, rest, drink some fluids. These are all warning signs that your body is telling you. And heat cramps can go to dehydration, or it can just skip and go straight to heat stroke or heat exhaustion. So this, listen to your body if you experience this, or if you're worse, somebody that is experiencing heat cramps. Next slide. So again, this is the full slide that you saw earlier. It's from CDC. And again, it's in English and Spanish. It has sunburn and heat rash on it also. They're not as, well, sunburn can be serious if it's 3rd degree, if you're out there too long. But you can use sunscreen, SPF of 30 or above, and heat rash. Just try to change your clothes if you're sweating too much. But you can get this information from CDC. If you're interested, you can post it where you work. It's very easy to understand. Next slide. So the first aid in general for the heat illness is, again, you call 911 if you suspect heat stroke or if the symptoms of heat exhaustion are lasting more than an hour. Like we said, like I mentioned before, you're going to discontinue any physical activity that they're doing. Please don't let them ignore them. These alerts that your body's telling you to do. So stop your physical activity, or if you're with somebody that's experiencing symptoms, have them stop. Again, move the person to a cooler place, shade if you can, move them into air conditioning. You can lie them down with their legs elevated or loosen or remove their clothing. Again, we went over, if you suspect heat stroke, don't give them anything to drink. You can apply cool, damp towels. You can take a scarf. You can take these cooling towels, get them wet with water and put them around your neck or the person's neck, not tight, but this will help cool them down. You can put ice packs on them. You can put them in their groin area, under their arms, armpits. You can pour water over their head. You can pour ice over their head. Or feet, and you can put their feet in cool water, whatever it takes. If they're alert enough, you can put them in the shower. And if they have heat exhaustion or cramps, you can give them water or sports drinks, but very slowly. It's better to give someone that's having any kinds of symptoms of heat illness, usually just water. Don't give them sugary drinks because this makes them more thirsty. Don't give them alcohol because this dehydrates them. So water's the best thing, or sports drinks slowly, or electrolyte solution. Next slide. So again, some preventive things are, of course, don't leave your children or pets in an unattended car. We are all familiar with those sad stories of when this has happened. Limit their outdoor activity. Make sure, again, they stay hydrated, mostly with water. They can stay informed. They can check the weather or heat alerts. You know, if you have an iPhone or another phone, it talks about it. It gives you information on heat alerts. In fact, my phone is saying today that we're under a heat advisory until tomorrow at 7 p.m. here in Miami-Dade County. Limit their outdoor activity. Some of these are common sense. Wear a hat, light colored, lightweight, and loose clothing. So many times I see people in black shirts that absorbs the sun. Check if there are medications they're on or you're on that these can provoke illness in extreme heat. For example, something called a diuretic that some people with high blood pressure takes that makes them urinate, and that can cause them to be more susceptible to dehydration. Other medications may decrease their thirst, or it may affect the way that they sweat. So it's a good idea if you're on different medications that you talk to your healthcare provider about this to see if they possibly make you more susceptible to heat illness. And then rest, like I mentioned before, takes cool showers. Next slide. Now, something really cool, the CDC announced a new heat and health initiative just this year in April 2024. So you may just want to Google CDC New Heat and Health Initiative and check it out because they've got some really fun interactive tools on there with important information. For example, the heat risk forecast tool, because there's 3 of them. If you click that on, what that does is it takes you to a map of the United States, and it's color-coded how hot it is in different areas of the United States. And then on the left side of the screen, they have this numeric color-coded graph. And on one of the columns, they have the colors that match the colors of the heat temperature that are on the map of the United States. And they start with light green, which is 0, and they go down to 4, which is the most extreme, and it's a purple or a magenta color. And then on the right side of the screen, it lists which people are more susceptible to heat illness at these different temperatures. So you can check that out. And the second one is called the CDC Heat Risk Dashboard. And if you click that on, if you put your zip code in, it will tell you what the heat risk is for the next 7 days. And this is something very good for the general public. It also talks about the air quality index, which is also on our phones if you haven't noticed it. And a lot of times the meteorologists or the news talks about this too, because when it's really hot, what happens is that increases the ground ozone level. If you've ever been in traffic and it's a hot day and you look at the exhaust coming out of the cars ahead of you, maybe you see this like gas coming up. Well, that's what happens with ground ozone. So this makes people that have respiratory problems like asthmatics or somebody with bad allergies more susceptible to heat illness in this type of situation. So it has that, and it talks about other pollutants also. And the last one, which you can check out too, this is mainly for clinicians, and it gives us clinical guidance, and they talk about vulnerable populations because some populations are more vulnerable in the heat. Like I mentioned, people with cardiac problems, people with respiratory problems, people with diabetes, because again, their bodies are already compromised, children, because their thermal regulation system, their thermostat isn't mature enough. They need to be monitored by people because they don't know when they get too hot or when they need something to drink. Homeless, people that are unhoused. These are some of the vulnerable populations that are more susceptible and prone to heat illness. So it talks about that, and it also talks about patient management, specifically with people with cardiovascular disease, women that are pregnant. They're also a more vulnerable population to the heat because they're carrying a fetus inside of them, so their body is already working harder. And if you've ever been pregnant in the summer, like I have, you're much hotter than everybody around you. So they're just more susceptible to heat illness. And then there's one more that's an overview on heat in children and teens with asthma. So I encourage you to check it out. They have some handouts also that you can download. Next slide. And then this is a really nice infographic. If any of you are involved in talking to people in your office or the community, this is something you can post. I think people are more receptive to seeing infographics, pictures. So on the left side of the screen, these are just some signs of hypothermia, which is just being too hot. In the middle, the temperature showing how hot it is. And on the right, some tips to prevent hot weather illness. And you can download this also. Next slide. And the rest of this presentation that I'm giving is just mainly talking about these different handouts you can get. This is from Miami-Dade County. If you go on the Miami-Dade County Heat Task Force site, you can download this. I think this is in Spanish and Haitian Creole. Just simple things. Drink water, find shade, and get rest if you're getting too hot. Next slide. And this is a more detailed one if you want to see it. I think it's from OSHA. And again, it talks about the heat illnesses and factors that increase your heat illness risk, including humidity. It's harder for the body to cool down when you're in a humid situation of heat rather than a dry. Next slide. And then this is another one from Miami-Dade County, and this is definitely in English, Spanish, and Haitian Creole. And it talks about who are the vulnerable population and what you can do if you're getting too hot. These I've seen in libraries in a lot of places in Miami-Dade County, so you probably will see this. You can also download this. And I'd like to say also that if you know people that are unhoused or maybe they're not able to pay their electric bill or their electricity goes out or yours does, you can go to a library in Miami-Dade County to get cooled off. Hopefully their air conditioning is working. And you can go in there because they have been mandated to be places where you can cool off. And there also may be some cooling centers in town that you can go to, and you can go to a mall and cool off also. Next slide. And then this is a really cool slide that Dr. Holder brought to my attention earlier this week, and this is from Duke. It's very clean and fresh, easy to read and look at. Again, going over some of the different heat illnesses that are on here. It doesn't mention dehydration, but it talks about fans. Fans are good up to a certain degrees. And I also want to mention that heat is not only for being outdoors, but if you're working indoors around machinery and there's not a very good airflow, a person or yourself can also be susceptible to heat illness. Next slide. And this is something that the Florida Clinicians for Climate Action developed. And we have this in 3 languages. And this is something that we're handing out to the clinicians in these high vulnerability heat areas in Miami-Dade County. You're welcome to read it also. It's very detailed, but again, it's about interventions to protect our community. Next slide. And there's a back to it also, if you get the slides. And this one didn't come out well, unfortunately, but this is emergency medical care. It's something also that's handed out in our community, and it's got a list of the hospitals that you can go to, and it also suggests an emergency kit. Unfortunately, it didn't transfer well. Technology, and next slide. And this one did, though. Again, there's that very popular heat exhaustion versus heat stroke. And these are cooling strategies also that you can use in order to work in this hot environment. And I think that was the final slide. Is that correct? Yes. And so please let myself and Dr. Holder, do you want to mention anything else that I might have left out?
No, great. I think we can take some questions and then we can see anything else what comes up.
Okie dokie.
Yes, thank you very much.
Thank you.
Okay, thank you, Dr. Cheryl and Carol Lindsay. I appreciate it. We did have a few questions in the chat. The first one was from Paulina. She said, do you typically have to have more than one symptom for heat exhaustion?
You want to, Carol?
Oh, go ahead, Dr. Holder, if you'd like to answer it.
Actually, it's hard to not have more than one, because to get to heat exhaustion, usually your body's feeling tired and you're sweating, because one of the first things, your heart is going to speed up to pump more blood, to get out to the skin, to cool it down. Your body goes through some changes. So just to get to adjust to the heat, your body is already changing. So one is significant, especially if you're feeling a little weak or dizzy. But before you got there, your body was doing changes that you may not have fully recognized. So 9 out of 10 times, there are more than one symptoms when we just check your pulse, or we listen, or we see how you're breathing, or we see that you've slowed down a bit. So there are a lot of other signs that we see. But definitely, if you have one and you think you're exhausted, that's enough. Get out of the heat, get some cooling.
Okay, thank you, Dr. Holder. The next question was from Facebook. They said, what are the long-term health effects of repeated exposure to extreme heat?
I'll take it, and Dr. Holder can answer it also. Thank you for these questions, by the way. The long-term effects, if they have repeat exposure to extreme heat, well, sometimes we see it. For example, an example would be maybe agricultural workers. They may have kidney disease because they get dehydrated out there. They're not drinking enough fluids. Maybe the water is far from where they're working, so they're not motivated. They're trying to be as efficient as possible with their time. So I would say dehydration could be a long-term effect. Also, exposing your heart. If your heart's working harder to cool you down, if you're exposed to extreme heat, and if you keep working your heart so hard, if you keep going out and exposing yourself to that extreme heat, it's going to start, it could start just wearing out because you're doing it so often. That's what I can think of offhand, Dr. Holder.
Yeah, great question, because it's what we call a threat multiplier. So if you're young and healthy and you don't end up with a heat stroke, the constant exposure can put you at risk for having a complication from it. So you get dizzy and you fall off the ladder and you break a bone and all this other, it's like a domino effect. So that can then set that person up for a chronic condition that wouldn't have happened had they not gotten heat exhaustion and fallen off the ladder. So in medicine, it's sometimes real difficult to put all the pieces and get it back to the heat. So that's why we have difficulty saying how many deaths, how many things happen. I mean, the worst outcome of too much exposure is death. It may not have happened on the first time, but on the second time, you had something happen. But kidney failure is one of the big issues that we're seeing. And we find the mood changes, irritability, that can then lead to other complications. So that's how we look at it in terms of what does it set you up for? What did that threat multiply and maximize in your life? And how can we avoid this? Learning is a new data. They're looking at learning because they've done studies in classrooms with children and the learning is affected. So that is a big concern because then that's going to show up on testing because they're falling behind. So for me, that's another big long-term damage from the heat.
Thank you, Dr. Holder. And another question we had from Facebook is, how does extreme heat affect mental health and cognitive function? Another person said, I believe her name is Jacqueline, they're very interested in the effects of mental health for outdoor workers as well.
Yeah, that's a great question. We can both answer that. I mean, they've done studies that show that when people are in extreme heat, it increases the suicide rate. So people that are depressed get more depressed. There's a lot of literature out there on how it affects our mental health. It's harder for people to focus and concentrate if they're hot. Students in a classroom where it's too hot. People working outside with heavy duty machinery, it can be dangerous. People might get hot-headed in traffic. It increases anger. There are studies that are showing, some have even showed that there's more automobile accidents when it's hot. So it can definitely affect the cognitive function. And I think there was an article the other day showing how bad it is, how it really affects our brain too. And the mental health for outdoor workers too, they're exposed to that all the time. It wears them out. They get tired. They're extreme fatigue. They may not be as productive as they normally are. So there's a lot of effects. That's a great question, and that's so important. And Dr. Holder, would you like to comment more?
Yeah, one of the other areas that we sort of ignore is the nighttime temperature impact on sleep. So if you're not wealthy enough to be able to run your AC to keep your house about 75 or less, 73 to 75, 73 is like that magic temperature to sleep beautifully, you don't sleep as well. And that is also linked to cognitive decline, worsening obesity, worsening dementia, just having that sleep. So the worker is getting up and going out, sleep deprived because it's so hot at night. And then they're dealing with the stress of a very, very difficult job. So you definitely can see why all the other factors play out that Carol talked about. But the issue of the nighttime temperature with the daytime, they did a study out of Emory where they looked at outdoor workers and they put in sensors, internal body sensors, and see what time of the day they're out there working that their body internally started getting overheated, over 98.6. They were almost at 100 by 8 o'clock in the morning in the heat and the humidity. So we know the impact of the outdoor workers starts early. And unless they get some rest and shade, that can pretty much worsen pretty rapidly. So that's mental health is absolutely worsened. And if you have an underlying mental health condition in which you're on medication, that hypothalamus mechanism that Carol talked about is disrupted. So then the sensation to heat is not even as aware, and you can get hotter. So that also worsens the behavior. So it's just overall, it worsens everything.
Mhm.
Thank you, Dr. Holder. I'll go ahead and pass it to Jeanette, and thank you to everyone for all these great questions. We'll definitely be sending them in a follow-up email with some resources as well.
I think there's one more question in there too, Jeanette. So,
The last one. I
yeah,
will
the
do it.
last one.
Yeah, do you want to take one more? One last one?
Yeah, let's do it real quick. I'll do one word
Okay.
answer if possible. I
Yeah.
talked
Okay,
too
go
We
much.
ahead,
have
Vanessa.
time. I'm sorry, Jeanette, if we have time.
Yeah,
Thank
it's
you.
Vanessa Addison said, do you know what, if any, public health strategies or OSHA policies have been implemented to try and combat kidney disease in agricultural workers?
The research is still on. The big push is for OSHA to be able to put in guidance. OSHA does not have any policy on outdoor workers right now. They have suggestions, recommendations, but to have strong policy, they're about to release them and they're going to be open for public comment. So please pay attention to the news and comment and support it. So that is going to be the one way to guarantee that by 80 degrees heat index, not even 90. OSHA guidelines is now recommended 80 degrees heat index for outdoor workers, that they get 15 minutes every hour or every 2 hours, or I forget the actual number, but there's something that's coming under the Biden administration. And so policy drives everything. So please, when you consider, if you want to protect outdoor workers, you've got to see who's going to put in policies that will protect them. So Florida has stopped our ability to protect, but OSHA is coming up with some policies that will do it, but they're not even near approval. They're just at the second level. So we have to keep fighting right now. But the data is coming in on the kidney function. So we don't have strong enough data, so they couldn't say particularly yes for kidneys. They just said water, shade, rest, and what temperature.
Thank you, Dr.
And
Holder.
Dr. Holder,
Yeah.
Jeanette.
just one more question really quickly. So what are some medications or substances, alcohol, et cetera, that can perpetuate heat-related illness?
Oh, another question. Carol, well, alcohol, you know, most substance use during the heat will cause some disorientation. And what we see is it makes them make bad decisions. So the marijuana smoker might just fall asleep outdoors and get exposure that way. So alcohol itself does cause dehydration. The psychiatric drugs do change how they sense, so they're much more likely. Water pill, there are drugs like we call beta blockers, other medications that you will have to discuss and see how they could work with your doctor. So I don't want to give a list because you really should talk with your doctor. Also, the heat, if it's stored badly, is another problem. Medication storage is very important. Hence, insulin should not be put on ice and put on gel packs in case your electricity goes out. You take your insulin and throw it in the ice pack. That really doesn't work well with the insulin. You should protect it and not keep it directly on ice, but that should be kept cold. Some insulins. Some medications lose their effectiveness when it gets too hot. So these are all things that you've got to talk with your doctor. And if you don't have a doctor, Florida Clinicians, we have our Instagram. You can DM us. We can't give you medical directly for you, but we can give you guidance on where to get the information and what the data shows based on the question, but we never tell you for you. But FL Clinician Instagram and our Facebook page, Florida Clinicians, and you can DM us with different information and we'll guide you.
Yeah, and go to that CDC website because it
And the
lists
CDC,
something.
yeah, they have the long list of medications.
Yeah, not alcohol.
No alcohol, please. There's no cool beer that they show in commercial. Every time I see it, and I see the ice and the water, and it looks so refreshing, and they sell it as the most refreshing drink after a hot day's work in the field. I'm like, that's just the worst thing.
Yeah, it's a shame.
Thank you so much, Dr. Holder and Carol. We have 1 minute left. We definitely want to be respectful of everybody's time. So if you have any additional questions, we will be sending out a recap email with a survey link, so you can put your questions in there and we can reach out to Dr. Holder or Carol and get some answers for you. So just in conclusion, we are going to let you know a little bit about the Miami Climate Alliance. And this training was birthed through one of our working groups, which is the Climate and Health Working Group. And we come together to solve issues on the intersections of the climate crisis and health justice, including the disparate impacts of extreme heat. We meet once a month at 4 p.m. on the third Thursday of the month. So if you're interested in joining, you can grab the email here, or you can get it in the follow-up email. We'll send everything to you. And also, if you want to subscribe to our newsletter, you can take a picture here and subscribe easily that way. So we are done. I'm so excited for this training. This is a lot of great information. I hope you learned a lot, and we look forward to seeing you all very soon. Have a great night, everyone.
Yeah, thank you. Take
Bye.
preventive measures.
Stay cool. Stay cool.
Rest.
Bye-bye.
Bye-bye.